What if you could address complex trauma in as few as 3 sessions? Developed as an offshoot of schema therapy, imagery rescripting aims to challenge and modify distressing or unhelpful images and their meanings. To provide empirical assurance, I've referenced a meta-analysis that revealed its compelling effect size of 0.9. First, let's take a moment to highlight the importance of building a solid alliance. It's the scaffolding on which the entire therapeutic process is built, and only with it are you ready to delve into this technique. The first key decision point is discerning whether imagery rescripting is appropriate for your client's needs. Traditional CBT or other therapeutic modalities may be more suitable for certain conditions, such as generalized anxiety disorders or non-trauma-based depression. However, imagery rescripting excels in addressing complex trauma and the resulting skewed core beliefs about the self, others, and the world at large. So, how do we operationalize this discernment? Assess core beliefs and emotional responses. Before considering imagery rescripting, deeply discuss their core beliefs with your client. Are they struggling with feelings of being unlovable, incapable, or unsafe? Do these feelings appear disproportionately strong in relation to the situations that trigger them? If yes, you're entering the proper territory. Client's readiness and self-awareness, imagery. Rescripting is an emotionally intense process. Clients should understand their emotional distress and be willing to confront it. Are they ready to engage with their past traumas? Have they been able to articulate their experiences, emotions, and triggers? Pre-existing rapport. As discussed earlier, rapport is crucial. Assess whether the therapeutic relationship is strong enough to withstand the emotional turbulence often accompanying imagery rescripting. This intuitive assessment should be based on concrete indicators like the client's openness to discuss complex topics, their comfort level with you, and their adherence to therapeutic agreements. Client's cognitive and emotional maturity. Make sure the client has the cognitive and emotional resources to differentiate between their past and present selves and handle the psychological distance this exercise requires. This differentiation is critical for effective rescripting. Identifying the critical memory. You're not only a therapist, but also an investigative historian of sorts. Map out a timeline with your client, zeroing in on memories that align with the dysfunctional core beliefs you've identified. What you're looking for is not just any distressing memory, but the genesis of those beliefs. Typically an event that occurred when the client was between 4 and 11 years old. Why this age range? The neural pathways associated with emotional responses are still highly malleable during this period. So, events occurring within these years can have an outsized impact on core belief systems and behavioral patterns that persist into adulthood. Children take things more at face value than adults, not yet possessing a robust filter to question and understand events and interactions. It's this filter, developed in later years, that we strive to help clients apply, using imagery rescripting. Your client will likely present multiple memories that seem to confirm their dysfunctional core belief. While it's tempting to latch onto the most egregious or shocking, your aim is to find the earliest one that left an indelible imprint. Watch for emotional cues when your client talks about these early memories. If they describe a memory, but their emotional affect doesn't resonate with the gravity of the core belief, dig deeper. The most critical memory often has a visceral emotional charge connected to it. You're aiming for a bifurcation point in the client's emotional history. Ask them, before this event, do you remember experiencing these disproportionate emotional reactions? If the answer is no, you're likely on the right track. The event should serve as a demarcation line separating their emotional life into before and after phases. Even though the memory seems to fit all the criteria, make sure you validate its link to the core belief. Ask the client, what conclusion did you draw about yourself, others, or the world after this event? Their answer should closely align with the dysfunctional core belief you are targeting. Once the foundations are solid, you're ready to introduce your client to the powerful tool of imagery rescripting. This technique diverges from traditional cognitive behavioral therapy by aiming to catalyze not just cognitive, but also emotional changes. Stage 1. embodying the younger self. The task here is to relive the original event. Posture and eye closure. Start by encouraging the client to adopt a relaxed posture and close their eyes. This sets the stage for deep introspection. Multisensory cueing. Your narration should include smells, sounds, and other sensory details from the original event. This depth of description can aid the client in embodying their younger self. Emotional alignment. This stage is often emotionally challenging. As you guide them, be attentive to any signs of excessive stress and manage it proactively. Stage 2. The fly on the wall. Here, the task is to adopt an observational stance perspective. Shifting. Help your client switch to an observational perspective. A fly on the wall. New lens. Encourage them to reconsider the events, paying particular attention to details they might have overlooked or misunderstood as a child. Stage 3, the rescripting phase, active imagination. Now guide your client in introducing their adult self into this memory. This is not about whitewashing history, but challenging the original narrative's conclusions. Protective actions. Whether it's confronting an abuser or bringing in a supportive figure, this is the point where they can exercise agency and rewrite the script. Stage 4, reinforcing the rescripted scenario. Here, the goal is to reinforce the new narrative. Repetition. Ask the client to relive the new sequence of events just as in stage 1, but this time with the empowering changes. Closure and integration. Close this chapter by asking them to perform a symbolic gesture that embodies this new reality, like speaking to their younger self or releasing a burden. While each stage typically takes one standard session, keep in mind that the emotionally intense first stage and the transformative third stage may sometimes necessitate extra time. Also, stages 3 and 4 are often shorter, as they're about consolidation rather than deep emotional excavation. You facilitate a complex emotional and cognitive transformation by moving carefully through these stages and remaining attuned to the client's emotional state. Your role here is to guide your client to rethink, relive, and ultimately rewrite a foundational chapter of their emotional lives. At this point, gently transition into a reflective dialogue with your client. This step goes beyond mere debriefing. Consider it a deep analytic session where you explore the client's evolved emotional disposition, insights gained, and lingering questions or concerns. Use open-ended questions to facilitate this discussion, and be prepared to employ additional therapeutic interventions as required. This is a fertile ground for reinforcing new emotional frameworks and addressing residual distress. The essence of effective therapy often lies in what happens after the session. Hence, scheduling a follow-up is imperative. Approximately 2 weeks after the initial session, conduct another meeting to reassess the emotional impact of the rescripted memory and any shifts in the client's overall mental landscape. Utilize the data from this session as a feedback loop for fine-tuning future therapeutic interventions. Okay, that's it from me. I hope it serves you well, and feel free to drop me a comment with any questions.